All right. Well, good morning. Thanks everybody for joining us today. I'm Kankakee County Board Chairman Andy Wheeler, and on behalf of the Healthy Business Alliance, which is made up of a lot of the business community, the health community here in Kankakee County, a lot of our community leaders, I would like to thank you for coming. And today is really on this beautiful Friday is really an opportunity for the health community and those serving you down in Springfield to kind of tell you what's going on within their niche, if you will, whether it's the schools or in the hospitals or the health department. Kind of talk about, we're not going to be data heavy, I don't think, but what we're doing is we're trying to discuss what's working, what needs to improve, and what might be between the lines on the data, because we have some numbers out there and we're trying to put it in local perspective, all the while reminding people that it's up to us to keep each other safe in this situation that we find ourselves in. So with that, who's going to speak today is Chris Schride. He's the president and CEO of Amita Health St. Mary's, and Kyle Benoit, the senior VP and COO of Riverside. John Beavis, our Kankakee County Health Department Administrator. Dr. Greg Murphy, he's the Kankakee and Iroquois Regional Superintendent of Schools. Dr. David Pickering, the Executive Vice President and CFO for an ONU perspective of this. Senator Joyce, if he can join us, and Representative Parkhurst to kind of what's going on Springfield, their local viewpoints, things like that. Then we'll open it up to Q&A. So with that, I'll hand it off to Chris Schride, President and CEO of Amita Health.
Thank you, Chairman Wheeler. I appreciate that. To open, I want to thank the many members of the Healthy Business Alliance. We have a large group of public servants and local business leaders who are committed to the health and well-being of our community. And their advocacy with the state and their leadership here at home really benefits all of us. It's our families, our schools, our neighborhoods, and businesses. So appreciate all the work that they've been doing. And to the topic of my own work family here, I also want to express deep gratitude on the front end to a large group of strong and really resilient professionals here at Amita Health St. Mary's Hospital. They've done an amazing job for our community throughout this very unique 2020 year. And we've saved 143 acute COVID patients who are back to their homes and their families. And throughout the year, their diligence and expertise, both of our physicians and associates, have made St. Mary's not only a safe environment with a proven record of not having any outbreaks, but also a place with sophisticated protocols and treatment plans. We're really using best practices to successfully treat COVID, minimizing our vent usage, and lowering the length of stay of patients here at the hospital. So that really leads to the topic of what are we seeing now. And over really the last few weeks, we've seen a larger number of COVID-19 patients reported. I mean, that's part of why we're having this press conference. And it's not only here at St. Mary's and at Riverside, but really across the state and across Chicagoland through our other Amita Health facilities. And so while COVID is being found, though, I think it's important to know that while we have a higher propensity and positive rate of COVID across even our county, there's not really a direct correlation, or at least a one-to-one correlation to hospitalizations. So our percent of admissions per positive case, it really does continue to diminish. So our positivity rate here has actually since like around mid-July has slowly started tracking up. Beginning of this, we continued to go from a high rate of positive rate, and it slowly moved down as more testing came and more people were being tested. That percentage drop, but we've been slowly increasing, really about a 0.1% per week, and we're at 6.1% positivity rate. But while that has happened, our hospitalization rate has not moved at the same rate. We've actually been decreasing our hospitalization rate of those positive cases, and really set around 17% right now. So while we have an increase in COVID patients being treated on an inpatient basis, know that the hospital is not overwhelmed, or our resources are not being pushed by a COVID surge. In truth, our hospital is busier now, but it's really those traditional patients who are coming in for our care, procedures, treatments, testing. So many patients who have waited for care, treatment, testing during the earlier months of 2020 are now really needing that assistance. So they're arriving with higher acuity and being compromised. And so, as we've mentioned in the past, we continue to urge you to see your physicians, follow up on recommendations. And, you know, if you're feeling sick, you need to see someone. Come into the hospital, be tested. You know, we've proven through 8 months of this, you'll be safe. Our physicians and staff keep patients and visitors safe. And so as this COVID numbers continue to creep back up, it's really, one of the emphasis of this discussion is to get back to the basics. There is a real need to re-emphasize to our families, friends, and coworkers the need to sustain and maintain precautions. Our county has performed well. We really have as Kankakee as you compare to other counties, but it's not because of luck. It's because we've taken COVID seriously, and we've done it in reasonable ways, in reasonable everyday ways to diminish the risk of spread. And it's something we still must do, whether you're in your home as a student, in your business, or out and about in the community. The basic precautions work. They have worked, and they will continue to work to keep our county strong. So for those listening and feeling fatigue in a case of COVID blues, stay the course, stay diligent. It works. You know, continue being vigilant, to wash your hands. You know, wearing your mask, socially distance. You know, avoid large gatherings. You know, if you begin feeling sick, get tested. And when you get tested, stay home. You know, we're performing about a little over 1,000 tests a week through our drive-through testing service. We've been doing that since early April. You know, knowing if you have it helps you and your family make the right decision. And so don't hesitate. And don't hesitate to seek and follow up on the care that you've been recommended. You know, another piece of this really is for those, when we talk about fatigue and, you know, COVID blues, what we've been trying to do with staff since the very beginning is providing outreach, giving resources, giving, you know, virtual groups, et cetera, and trying to come alongside them during this time. You know, we're no different, and certainly there's kind of been an intensity for healthcare workers. And so they're feeling the same thing. And so while we've been doing that, we recommend you seek some support group, seek someone who, you know, you can speak to if you're feeling that at home. We know that's a case for all of us, and for some it's pretty intense. And so, you know, whether it be with professionals, which we certainly have available, or with other support groups within this community, or in your neighborhood or your church, we just recommend that you reach out. It's proven to help, and it's important both now and especially as we get to the holiday time. So I want to just close by making sure you know that St. Mary's is confident and ready to help you and your loved ones. We've proven it by providing successful care throughout 2020, and we've maintained our status as a national top 20 hospital in patient safety, you know, for 3 years in a row, and we've performed well throughout this year. And so there's got a lot of gratitude to the physicians and staff who continue to do and be diligent day in and day out. You know, but be confident we have the resources, the PPE, the expertise, and the track record, and a loving staff to handle whatever's in front of this region as we continue to 2020 and into 2021. So thank you for listening, and I just leave you with you know, an encouragement to find an active way this weekend to reach out to your friends, your neighbors, your family, and show some love today. So thank you.
Thanks, Chris. I really appreciate that, and for the perspective of you know, Amita Health, it helps to put some local, you know, really the data, how it's being applied within your facility and how it's manifesting within the services you provide. Kyle Benoit is next, Senior VP and Chief Operating Officer of Riverside.
Thank you, Chairman Wheeler, for giving us the opportunity here at Riverside to kind of speak to the community today and setting this up. You know, I would say probably a lot of the comments, questions, what we go through today, probably not much different than what Chris just described for Amita. You know, a lot of what's going on in healthcare, but it's safe to say the second surge that we've all been talking about and preparing for to occur in the fall is here. But at Riverside, we are more than prepared to handle this challenge that lies ahead of us. We have worked diligently to improve our treatment protocols, our best practice guidelines with great physician leadership and nursing input. And we're seeing great success in the care of these patients. You know, we have more COVID positive patients in the hospital right now than we did in the spring, but we are prepared in handling it well as taking care of all those patients that are non-COVID that just need to come and seek care outside of that. Over the last several months, we've been in this journey for about 9 to 10 months. We've increased our PPE. We've increasing our testing capabilities, and Riverside continues to really be a county leader. We're doing about probably 500 plus tests a day over the last several weeks, and we keep seeing those numbers increase, and we have the capabilities to do that. We've also worked hard to increase our PPE, as I said, so that our staff has what they need to provide that safe and efficient care to not only COVID positive patients and all patients. And I do want to pause right there to really recognize our staff, our nurses, our technicians, the physicians, all patient care, direct patient care staff, non-direct patient care staff have really done just a phenomenal job this year and all the time, providing care and excellent care for all our patients. And we can't thank them enough for what they've done each and every day. They're tired just like everyone else is tired, but they continue to come in and provide that excellent care, and we can't thank them enough. And I hope really everyone throughout this county takes the time to thank a healthcare worker for what they're doing. We prepared for this second surge. We're more than prepared, and as we've seen an increase in COVID positive patients, we're just as busy in other areas. And that's really a message I want to hammer home for people today. During that first surge, during the lockdown of the spring, when there was so much unknown, we saw lots of people afraid to come to the hospital, delaying their care, experiencing chest pain and saying, I better not go in because I don't want to get COVID. I can assure you the hospital is safe. We have put so many treatment guidelines and protocols in place to ensure the safety that we really encourage people, do not delay your care. Do not allow your loved ones to delay their care. The hospital is safe to get care. We are prepared to take care of COVID positive and COVID negative patients. And that has always been the case and will always be the case. And so I really just want to encourage the community. While we see the numbers rising, our treatments are improving. People are going home quicker than they were in the spring. But we're also able to take care of all patients with stroke-like symptoms, with chest pains that are needing elective procedures. We are essentially open for business to provide that excellent care for them. So again, I just kind of echoing what Chris said, this pandemic has been mentally and physically draining for everyone. Everyone's tired. I know at times I've had my moments of being exhausted, but we must remain vigilant as a community because the pandemic is still going on and the cases are starting to go up again. And we need to wear our masks, wash our hands. I encourage everyone to get a flu shot. If you haven't gotten one, please get one. See your healthcare provider for a well visit if that's what is due up, and avoid large gatherings at all costs. I know I'm confident that we can all get through this together. And we'll have the day when we won't have to worry about wearing a mask all the time and try to get back to some sort of normalcy. But right now, we need to be vigilant and really care for everyone in this community and really thank a healthcare provider today. So thank you for the opportunity to provide an update and look forward to people's comments. Thank you.
Thanks, Kyle. Really appreciate that. Next up is John Beavis from the Kankakee County Health Department.
Hi, thank you for the opportunity to speak today. I've just got a few comments, and it's going to echo a lot of what both Riverside Hospital and Amita has said. And those are the points that we are wanting to make sure that we continue to drive home. As Kyle just said, a lot of us are fatigued and tired, but we get up each day and we do it again, and we're just asking the public to continue to do what we're asking them to do. In the recent weeks, obviously, all areas of Illinois are seeing an increase in the COVID-19 cases and the positivity rate, which gets talked about a lot. At Kankakee County right now, it's almost 12%, and with our Region 7, it's almost 13%. Obviously, we're seeing more cases, but as the hospitals both said, we've learned so much in the past 8 months on how we can treat this. So the virus is there along the lines of a lot of other illnesses that we just need to be vigilant about and still taking our safety precautions. As a result, the governor has all regions of the state in mitigations right now, including our Region 7. So even though the numbers are going up, the health department will continue to do what it has from day one. Most important is the contact tracing that we are doing here at the health department. We have hired 10 additional contact tracers. We're getting ready to hire 4 more because of the surge. That, along with the education, the consultations, and the planning for when a vaccine is available in our community, and then doing the mass vaccination event, is keeping us pretty busy here. And again, I would like to applaud our staff for what they've been doing since day one. A number of them have had to change their roles from their normal duties to get into the trenches of COVID, and they've all been doing that. So I applaud them and would like them to be recognized also along the lines of all the other medical care people. But we ask for the public's help. Please, there's so many things that we all can do here together to continue to help slow this spread, to stop this spread. So in the past 8 months, again, we have learned so much about this, but that doesn't mean that we can just stop doing what we were doing and start with this new normal that everyone's talking about. We're still in this race, this pandemic, so to speak, and we have to keep doing the things that we can do. So again, touching on some of the things that have already been said, please continue to wear your mask. Please wear it correctly and properly. Please continue to maintain the social distancing, whether you're out in the public, whether you're at work, or whether you're at home or doing something with your family and friends. It's easy to get comfortable around those that we know and love, but they could have been out last night and exposed to the virus and potentially then be exposing you or me today. Avoid the large gatherings if you can, but if you can't, then please wear the mask, as I'm saying. Stay home when you're sick so as not to expose others, and especially don't go to work if you're sick. Kyle said it from Riverside, get your flu shot if you haven't. There's so many pharmacies, your medical providers, the hospitals, the health department all offer the flu shot. It's not too late to get it. A lot of the symptoms are going to be similar, so you could get confused, and that's why it's important to take those precautions, get tested, and then stay home when you're sick. And then with the approaching holidays of Thanksgiving and Christmas, and even the school breaks that are going to take place during the cold weather, we're going to be indoors. It's going to be harder to be outside with an Illinois winter. I understand that. But you just need to take these precautions that we're talking about. This is going to be about we, not me. Your actions can, will, and have made a difference as we move forward. I want to thank everybody in the community for what they've done since day one and are continuing to do now. I know when I'm out and about, I see most people wearing their masks. I see them social distancing. I see them helping others, and that's what we need to continue to do. We need to help our neighbors as we would want them to help us. But with this surge, we see that we must all continue to do these things to support one another. Finally, if you happen to get COVID or if you are called as a close contact from the health department in regards to this, I just want to reiterate, we're starting to let people know you're going to see what looks like a strange phone number. It's 312 area code. So some people might think that that's from Chicago or maybe it's a telemarketer, but the state has a computerized program, so that's the same number for everybody. It's 312-777-1999. That's 312-777-1999. It should come across as COVID contact tracer. So please answer that call. Cooperate with the questions. This information is going to be helping us better understand the virus and how it transmits from place to place so that we can determine where exactly it's happening, how exactly it's happening. And again, I want to thank you for all you've done since March, continue to do even today. And again, thank you and stay safe.
Thank you for that, John. And just to remind everybody, we'll be able to circle back with questions, Q&A at the end in case people have developed some of these questions. Moving on, we have Dr. Greg Murphy. He's the Regional Superintendent of Schools for Kankakee and Iroquois counties.
Chairman, certainly appreciate the opportunity to be here this morning. I'll be brief because I think that we're hearing very similar messaging from all sectors of the community today. But as an update, our school districts continue to rely on the Illinois State Board of Education as well as guidance from the Illinois Department of Public Health as they make decisions for their students. I can't emphasize enough the efforts of the county health department in supporting our schools during this time. It truly has helped educators to become educated in an area that we're not used to having to have opinions and work through, and the health department has worked to bring up our staff so that we better understand the coronavirus and how to react in situations when it does present in our schools. Our districts have made significant changes in their schools to address the concerns of the spread of coronavirus. To that end, the schools have been largely successful. Schools have made changes to classroom setups. They emphasize cleaning of surfaces, hand washing, and what we're seeing is that when students or staff are ill, they're remaining home, caring for themselves and seeking health attention. And that's been very helpful in allowing schools to stay open as long as they are. We do see some rolling closures throughout, and that's as we work with the health department, they're able to recommend the best course of action, whether that be a remote time, whether it's in-person instruction or blending of the two models. But for these actions to be most successful that the schools are doing, we need to encourage that same level of effort to control the spread outside of school. So I believe that we're hearing that today in the message from our hospitals, from our local health department and others. We need to stay the course, make use of face coverings, wash our hands, and observe social distancing. And that allows the efforts of the schools to be maximized, and it keeps families safe when they're at home and about. And with that, I'll turn it back to you, Chairman. Thank you.
Thank you, Dr. Murphy, for that. And I guess to stay on education, Dr. David Pickering, the Executive Vice President and CFO for Olivet, from your perspective, Dr. Pickering, what are you seeing? What are you guys experiencing?
Yeah, thank you. And I know we're sounding like a broken record, but I would just like to reiterate, we've had outstanding help from local hospitals, providing assistance to us, staffing to help us. The health department has just been exceptional with contact tracing and helping us with our own staff that we have in our health services to manage that. So we have about 2,500 students plus over 500 employees. So it's like a little village located in Bourbonnais. And so for us, just having the resources to help us has just been phenomenal. You know, our students, as you can imagine, they want to be on campus. They want the campus experience, and they have done really, I'd say, an outstanding job of adjusting, you know, to being in class where you're 6 feet apart, you're wearing a mask, and it's like that every class period. And that's the way you're going to school is radically different from what they're used to. The way we do things on campus, the way the seating on campus in the cafeteria is a fraction of what it typically would be. And so students have made a lot of adjustments throughout the semester. And like the state, the university, typically every week, we make adjustments. So based on our contact tracing and the information we're getting back from our health services, from the county, we make adjustments. We stop activities, start activities. And so that's been extremely helpful to us. One thing I think that's just cool is yesterday, we had about 120 students donate to the American Red Cross. So I think we all know the American Red Cross has really struggled over the past months with blood donations. And so we worked on a safe way in a very large building for people to be able to come in, students to come in and work with the Red Cross, donate blood. And that was just phenomenal. I think speaks to obviously the Red Cross and their ability to do that safely, but also to our students who really do have a desire to help the community, be involved in the community. And so like the community goes, I would say Olivet goes. You know, we had many, many weeks where we had 0 cases on campus, and we were just amazed, right? Wow, this is going unbelievably well. And then kind of like the community, over the past few weeks especially, our numbers have gone up. We're putting more mitigations in place. We have 2 weeks left. We're done at Thanksgiving break. So probably the last 2 weeks will be a little tougher for students than what it's been the past month. But again, I think students are resilient. They're maybe a little easier to adapt than somebody my age. So they're very adaptable and very positive. So again, I would just like to say thank you to especially those in the community who've really stepped up and helped us manage a lot of people on our campus, but it's gone much better, I think, than we anticipated even back in August. So thank you, Chairman Wheeler, and thank you for your support of education in the community.
Thank you for the comments. And, you know, we do realize we have a small city out there nestled within the village of Bourbonnais. So it's, we always like to keep tabs on what's going on and how you guys are dealing with things. So, and, you know, I guess for the end, maybe let me just ask this question now. Are you concerned with kids going home and then coming back after break? And that would be for Dr. Murphy as well. I mean, is there any education going on with the students or the kids before, and with the parents before this happens?
Yes, so that's a great question. So we communicate with our parents weekly. So in the same way we communicate with students weekly, we communicate with parents weekly. And so with students last week, and again today, they'll be getting some more information from me later today. That's a big emphasis for us right now, is we want you to go home in 2 weeks or 2.5 weeks safe. So in order to accomplish that, here's what we need to do on campus for 2.5 weeks. So when you leave, we want you to go home in a safe way. That's important. I think we've all heard the CDC talk about universities and, you know, wanting schools to kind of keep students on their campus, not send the kids home. And so, you know, that's really our goal is, and really, really well. Again, we also know we live in a time where we're not expecting to have 0 cases on campus when we close in 2.5 weeks, because that's not the world we live in right now. But as best as we can, we want students to go home well. And then coming back in the spring, we're already talking about what we will do differently in the spring. We do have rapid testing on campus, which has really helped us in the last few weeks to be able to very quickly, well, instantly almost, identify 6 students. So that's been extremely helpful. And we are looking at some types of testing for the spring semester that we'd be able to do internally that would then lead to diagnostic testing being done through rapid testing. So there's a lot of different systems out there that schools are using in order to capture anybody who's sick faster, which just helps isolate that quicker and limit the amount of contacts.
Sure. And Dr. Murphy, is it similar, or do you see the education community, you know, we got reading, writing, and arithmetic, you know, but has it also become how to take the COVID information home and train your family, how not to come back from Christmas break and you know, start an outbreak? Yeah, I'm just curious, you know, how that works.
And I think communication is key with families to, we understand that there's the potential that students are going to become ill during this time, whether we're in session or out of session, but the communication between families and the school really centers around, let's identify those symptoms. Let's be certain that if we have a child that is symptomatic, that we're taking care of that and that we're maintaining the integrity, because our schools as well desire to be in face-to-face instruction. And it's been the efforts of the families to be vigilant. And when there's a child that isn't feeling well, let's not send them to school and let's have them see a healthcare provider so that we know, is this a case of COVID? Is this other seasonal flu or other things that we typically see in the school system? So yes, that communication back and forth so that we don't create outbreaks has been key.
Well, thanks for that. And then there may be other questions. I thought it was an opportune time to ask that because it's really right around the corner. We're all going to be having Thanksgiving and Christmas holidays. And I think there's a big concern that is, from what I've talked to with the folks in Will County and other areas, there's a real concern on that with these unofficial large gatherings. So it may not be time to take our foot off the gas as far as doing things the right way. Representative Parkhurst, did you have anything to add from your perspective on Springfield?
Yes, thank you, Chairman. As of Tuesday evening, the positivity rate in Region 7 stood at 12.4%. The Governor's Office and the Illinois Department of Public Health have said that heightened mitigation will be placed on our region if the positivity rate is above 8% after the 14 days of the initial last initial mitigation measures. So if imposed, the next tier of restrictions would mean outdoor seating at bars and restaurants would be limited to 6 people per group. Social gatherings would be limited to 10 people for indoor and outdoor events, and sporting and recreational events would see limits on groups and spectator sizes. So they have plans to even, put more mitigation measures in effect if we don't go below the 8% after that 14-day period.
Okay. All right. Well, then I guess we can go into questions. I would like to kick those off with kind of like, it's something that I think a lot of people wonder is our trends on the demographics we're seeing coming back with positives. And then tied to that or within the scope of ventilator availability, ICU bed usage for COVID versus non-COVID situations. I'm not trying to build a case that everything's okay, but what I'm trying to do is to provide some perspective, and I've heard some interesting things from the health community. And I don't know if you want to start, Kyle and Chris, with what you're seeing along those lines, ages, anything, is it any particular community that's being impacted? John may have, he's got data on that as well, so please, whatever you think.
Yeah, this is Kyle, but I can start. As the time has gone along with the positivity, the demographic age-wise, in the early stages, definitely a lot of the elderly, more compromised, comorbidities, what have you, but it's now hitting everyone. I mean, it goes into, you're in your 50s, 30s, 20s, even children age now. And really, and John, I know you probably have more data, more detailed data, but we're kind of seeing it across the board now from a gender, age, race standpoint of who's getting it. The severe, who it's severely impacting, I don't think necessarily has changed in the sense of individuals who have comorbidities, diabetes, heart failure, obese, what have you, underlying conditions. It's going to impact them more severely. And those are the individuals that are going to be hospitalized, as opposed to maybe a healthy individual who has no comorbidities. Probably they're positive with it. They'll have mild to no symptoms and they can take care of themselves at home. As it relates to, you mentioned ICU and ventilator availability, we, out of the 31 positives we have in-house currently, it is 4 in the ICU. And so the critical nature, it's not as critical as we saw maybe in the spring. And I can tell you the whole ventilator thing has really changed. In the spring, I think that's what everyone heard. We're not going to have enough vents. We're not going to have enough vents. However, now with the best practice treatment regimens that both Chris and I highlighted, it really is now keeping these patients off of vents. There are so many different things going on right now with steroid treatments and high flow oxygen treatments that, and even the positioning of the patients of how we're treating them, like in the sense of keeping them, doing everything you can to keep them off of the vents. Not saying that we don't have patients that are on the vent, but it is very small in comparison, very few and far between now, because we're doing so much other things that are much more effective in the treatment of those patients. So vent utilization or availability of vents is not a concern, or is it a concern of enough critical care beds?
Okay. So yeah, that was one thing. ICU, we still have kind of normal usage of ICU pre-COVID, but not necessarily for COVID conditions, I think is what you're saying.
Yeah, correct.
Part of the mix. Chris, do you see that too?
Yeah, I would echo. So from a resource, I think that's that's always the first question. Are there enough resources, enough beds, ICU, vent, et cetera, negative pressure rooms to isolate these patients? And in truth, both hospitals have done a good job of commandeering resources and setting that up. We did that a long time ago. And we've been consistent in having those resources, and certainly PPE, et cetera. But the trend is there that we aren't. I get those stats more than just daily, multiple times during the day, and I'm always it's alerting when we have somebody on a vent that's COVID positive. So that is not the norm. It's something that we are trying to keep from doing and have been successful in doing. So it's not normal. Of the patients we have that are COVID and even the PUIs today, none of them are on vents in-house today. And so, and that's traditionally what we would see. So there is success there. I would say, while, they're right about the ages, it's anybody, everybody, and, demographics are are spread across. But we have seen that as we do an average age, that has been creeping up. So from the beginning until now, of those who are hospitalized, they continue to be the hospitalizations who are acute COVID patients. The average age here continues to creep up over time. And it's not, statistically significant in that it changes anything, but it is something to note. And I think it's important to say that what's happening is the people who are, from the beginning, people were waiting, they didn't know they had it, or they're waiting before coming in. So they were more compromised by the time they hit the hospital and sought treatment. Where now people are getting tested quicker when they feel like they have symptoms, they're getting tested, they're getting care, whether it be on an outpatient basis or inpatient. And so that's really the key. There's less hospitalizations as a percentile, and those patients are getting care quicker and not really becoming acute. And so that, at least for me, that is the confidence building of how our community's handling this, that we really are seeing most of those that are symptomatic are finding quicker and easier care and staying home.
Well, thank you for that. And John, I don't know if you would have such detail on that, but along those lines, we had talked at one point in one of our Healthy Business Alliance meetings about the percentage of contact tracing calls that are being made. You have a bogey number that you guys are trying to shoot for. And then there was a smaller, much more disappointing number of the people who actually return the call. And I think this is a good opportunity to talk about that, because we're trying to identify hotspots. We're trying to figure out, is it big box stores? Is it the bars and the restaurants? Is it the schools? We're trying to get that data here, and you can't do that when it's a one-way conversation. So, and there's a lot of, I'll just say it, there's a lack of transparency on the numbers from the state. So we don't really know what's going on from the state until it's already happened to us. And John, can you speak to that a little bit about what you guys do on tracing?
I can, thank you. That gives a good opportunity through the contact tracing grant. The computer program that the state uses was rolled out at the same time that in the middle of the pandemic. So when we began hiring our contact tracers, unfortunately, they also had to then not only do their job to try to do the contact tracing, but then take that information and learn a new computer program that the state was then utilizing. So it's not the health department's program per se, but it's the state. So the tracers make those phone calls, they get that information, they put it into the system, which goes to the state. Now the state is getting ready to release some of that Salesforce data. That's the name of the program, Salesforce. So they're getting ready to release some of that data to be more transparent for each county, for the communities, for the regions. But we're not quite sure yet how exactly that's going to look out. But what Chairman Wheeler was referencing a moment ago is that we were given an example that, for example, one of the requirements of contact tracing is that we're to try to get to at least 90% of each new positive case on a given day within 24 hours. So 90% is a doable number, except for now when we're kind of in the surge, because we're getting more than we can handle, which is why we're having to hire additional contact tracers. That being said, we were a few weeks ago, right before the surge, Kankakee County was at 91% of being able to make those calls. The second number that Chairman Wheeler referenced, though, is the follow-up numbers, and that number was woefully low for Kankakee County. It was around 35%, and what that number references is follow-up. But that's not necessarily something that is that the health department is not doing, correctly, properly. Once I have contacted, for example, somebody and reached out to them within the 24 hours, we accomplish that number. But a lot of people, as hard as it is to believe, are not cooperating. They're not calling us back. They don't want people to know. They don't want to lose their job, or for whatever reasons, we're struggling with that. So the follow-up is us being able to then actually get the information we need from that individual case or their close contacts that helps us paint the picture. So those are those numbers that Salesforce hopefully will be able to tell us. Now, again, another thing then that I will emphasize is that through the contact tracing grant, the health department has recently hired a data analysis guy. Neil is his name. He's going to be working with us. We've got him into the system. He's beginning to work with the Salesforce data, and he's going to try to look at the information we have for the past couple of months and see if he can tell the story in Kankakee County of where potentially, as Chairman Wheeler and the community wants to know, this transparency of can we sort of show that more cases are coming from, you know, a sector, you know, a school, a business, a restaurant or a bar, for example, or is it just going to kind of be all over the board? We're not sure. So that information is in play. That normally the health department would not have an epidemiologist or somebody like that to have to deal with this on a day-to-day basis, as small as we are. But we do have the ability to do that now. So that is in play, and we're hoping that I can't promise when the information is available, but as soon as we have something, we will present it to county board meetings and make that public so we can understand a little bit better what's going on with the virus in the community, separate from the contact tracing then that the health department's doing in-house.
Thanks for that, John. I thought that was important to get that out there because we need people to work with us to tell their story so we can start to identify what those hotspots are. It's impossible to chase this down and protect ourselves to the fullest possibility if we don't know where those places are. So I appreciate all your effort along those lines. So with that, I guess we could open it up if the press has any questions of any of the presenters. I know they're on the line, so if there is anything, go ahead and just take yourself off mute and jump out there.
Andy, this is Jeff Bonte with the Daily Journal. Can you hear me?
Yes.
Okay. I guess this question would be for John, but maybe the two people from the hospitals can address this. It's it relates to long-term care facilities. Are we seeing any uptick with this second surge in those places, and what is or can be done to watch? What can be done? So that's my question.
Well, I can, let me start with that a little bit. I know in dealing with our contact tracers and talking to them on a daily basis, you know, we've got a chart up in the room, for example, and it lists current outbreaks that we're dealing with, those locations. You know, an outbreak right now the definition was changed, so it's 5 or more individuals at a particular location. So we've got a number of those throughout the county, and those can be as, you know, a business, it can be a long-term care facility. Again, with what the hospitals have said and what we're trying to stress here a little bit is we know so much more in the 8 months that we've learned from the beginning. The long-term care facilities or nursing homes, those congregate care settings have put in place a lot of things that are help protecting those patients and their staff, you know, with the screenings, temperature checks, and people staying home when they're sick now, better than we used to do even before there was COVID to begin with. So yes, there are some spots that are showing up again, but I think these facilities are in a better position today than they were in March to handle those.
The hospitals have anything to add on that? Anything you're seeing long-term care? Oh, okay.
No, if there's one thing I'd add, though, to what John had been saying is it's why the hospitals, I know we did from April, really from the start of doing testing in April, that we've required a physician order with it because we want follow-up. So that's the partnership between what John and his team are doing in following up and making sure that physicians are following up for those tests here. Now, we're not the only ones testing in the community, but it is why we mandate that, because we want, if someone has a positive, that there is a call, that they are getting a medical professional calling them up and having discussion where they might feel comfortable, where they might not with the Department of Public Health. At least, hopefully, they're talking with their physician. about what to do next and how to protect their family, their workplace, etc. So it's a key point, and we continue to emphasize that here.
Right. Any other questions? And then I guess the panel could ask each other questions, because every time we talk, we always sit here and that's half of the meetings we have on a weekly basis is kind of grilling each other about what we're seeing.
I do have another question.
Yes, sir.
And this is towards Dr. Murphy and maybe even Dr. Pickering. It's in regards to sports. I know the IHSA has made known where it's going to go with basketball, some of the winter sports. And I'm just wondering if this second surge might, I don't know if maybe brings maybe back into focus where things might go, how things might go. I know we deal with students on a learning level in that, but you also have the extracurricular activities. So I'm just curious.
So we've had discussions among the superintendents in the region, and the piece that I'm most comfortable with right now is that if I could describe it, we're seeing conflict between IHSA and IDPH guidance in terms of basketball, fall, winter sports. And what I'm seeing from our school leaders is just taking a moment of pause to allow those two groups to work through concerns of student safety, and realizing that some are advocating for extracurricular activities. I mean, we understand that. We understand the social emotional benefit that comes from that. And what I'm seeing from our school districts is they're waiting for that conversation to continue, and they're looking forward to following IDPH guidance and guidance from the governor as we move forward.
Yeah, I would say at ONU it's very similar in that, we work with the Illinois Board of Higher Education. They give us the guidelines for universities, and then they reference different organizations that we need to listen to. So, listen to this group as far as how you do the cafeteria, listen to this group as far as how you do athletics, listen to this group as far as something else. So they mandate some things, they mandate some of the academic pieces, but some of the other pieces are mandated by other organizations. So we follow those guidelines either from NAIA, who governs all of that, some of the other conferences. And so a lot of it is working with other universities, working with the NAIA. And I think as we head into the spring, not all of our sports, but most of our sports got moved to the spring semester. Track and cross country is still going on in the fall because of the nature of the sport. As you can imagine, all sports are different. Golf tends to be, very separated. There's a lot of distancing just in the nature of the sport, and every sport is different. Most of our, if we've had any concerns with athletics, most of those concerns have not been when they're practicing. It's not been the actual participation of the sport. It's more if a group of kids are hanging out afterwards who are all on the same team, if that makes sense. So there's a lot of protocols in place that were put in place by NAIA and IDHE. So our job is to follow the protocols.
Hey, Andy, could I ask a question?
Yeah, go ahead. Yeah.
Okay. This has to, and this is for the whole panel, they can answer in. With this surge and the mitigations, and we're all back in phase 3, I guess the concern is now, like Representative Parkhurst said, the numbers have upticked. We're not going back down 8%. What's the concern that we might go to back to a phase 2? That seems drastic. I don't think the public want to go that far, but Are we getting it? I guess what I'm asking, is this the slippery slope place with dealing with the COVID?
If I could just kind of tee this up a little bit for the answer, one of the reasons for this press conference is to try to provide some perspective and to keep doing the things that are working, and to remind people that the whole goal is really to protect those that are the most vulnerable, because that's where the mortality is in this situation. And I think that speaks to kind of where you might be going here. You know, I personally, from my perspective and government revenues and operations, and knowing that the courts still have to function and everything else that we still have to do, I just have my own opinion, and it's based on what I'm seeing as far as mortality, that the phase 2 would be a giant step backwards, because it would be unwarranted in terms of the public health issue. Positives are not, we're seeing, and I'll let the hospital speak to this, and health department, are not really, there is no direct correlation to mortality as far as increased mortality because of increased positives. And so with that being said, I don't know if you guys have any opinion along those lines from the hospitals and health department.
It's a tricky question to respond to, especially in a public forum. But I think objectively, what you've stated is correct. That there is not there's not a direct correlation through positivity to mortality. It's kind of the point I was making earlier about the hospitalization rate as it relates to the percentage of positive COVID testing. And so that's where the hospitals have confidence in how we're responding. We have confidence in our resources. We have confidence in how we can assess. The physicians are confident in assessing and setting up treatment protocols, and it's shown. It's shown that we've been able to do that to save lives, to get people who shouldn't be in the hospital. We don't have to have them here. Those who are acute and need to be in the hospital, again, aren't being put on vents, aren't doing more, higher levels of care than before. So I think as a county, we performed well, and I would agree that I feel like we're set up to do so, except in an extreme case of a positive rate or of a symptomatic rate within the county. I think we're doing well where we are now, irrespective of that positivity transition of that percentile. So I don't know if John has a different opinion on that, but that's kind of, we feel good about it.
I would just echo at this point that, and going along with what I'm seeing, what we have seen, and what we've said, and who we're trying to reach, hopefully. I know I brought this up at a county board meeting a couple weeks ago, it's not a number, so I apologize, Andy, but the complaints that the health department has received right now for individuals possibly not following, COVID guidance with the masking, the social distancing, 90% of those that we've investigated, those individuals are making reasonable efforts and are complying. So in essence, what that's telling me, and I think what I see in the community, is that 1 out of 10 people maybe aren't following the rules for whatever reasons. Maybe they have a good reason, or maybe they don't believe it. But if 9 are, I think that's a great thing for our community. And if any of those 10% are listening to this today, hopefully then you just recognize that what we're trying to say with the second surge is that the virus is still here, it's still present, it's still infecting people, it's impacting people. It can still kill some people. And that's what we're trying to prevent here. So please, thank you to everyone who's already been doing what we've been doing and continuing to do that. We're preaching to the choir when we say continue to do those things, but for those that aren't, this is the wake-up call. You can help our community, you can help yourselves, you can help your family and your friends by doing some of these things as we get into the winter, because now we're going to be congregating closer together again. And it's important, and it can only help then improve those numbers. I have no idea what the state will or won't do in terms of mitigation, but we will still continue to be doing the contact tracing on positive cases when they come in.
And then what I'll add finally to the question as well is you go back to the spring of why the initial lockdown occurred. It was more of the main driver of we didn't know what we were dealing with and we didn't want to overwhelm the hospitals. And I think what Chris and I have echoed today and what you've heard from John is what we've learned since then and where we're at now. We're in a much better position to proactively treat these patients and not have a huge burn on hospital resource that puts us in a place. So the hospitals are doing well. We're not overwhelmed. We've learned a lot. We're prepared. But it's just the other things that we highlighted to John's point that the public can do to help just, keep things at a more reasonable level is what we all described today, the mask on, the hand washing, what have you. But again, as is clearly demonstrated from Chris and I, both hospitals and all hospitals really across the state and across the country have really learned a lot and are much better in a much better position than we were, say, in March.
If I could ask a question of John, since we're kind of in open forum here, one of the things we're coming to with Thanksgiving, we talk about the holidays, et cetera, and we're on the cusp of Thanksgiving. We did it with Halloween of kind of as a group having a set of talking points that we spread out both to our own employees, to various community groups, and to the public online. It was a set of, here's a safe way of handling it. And I think it would, do we have something like that, or could we start generating something like that to provide to the community and kind of in a single voice again for Thanksgiving? Because we know that while we're asking people not to be in large groups, Thanksgiving is a time where some of those, I don't know if it's going to be the 10% you're referencing, but some people are going to be having large groups in their homes at that point, or larger groups, I should say. So it would be good to have a set of talking points of how do we do that safely? What are some recommendations to our community of how to handle Thanksgiving? It may seem simple, but I do believe some of these practical steps, it is the basics, and I think that would be helpful to provide.
That is a great point, Chris. Thank you. And I know that the state has in the past previously put out some information on holiday safety. We will get that put back up on our social media, and that can be shared out. And I know recently with Chairman Wheeler and the Healthy Business Alliance, we work together, we work together to help share that information about Halloween safety. And we can definitely do that with this Thanksgiving guidance. It's kind of best practices. So, obviously we're not trying to emphasize here, we're telling you not to have Thanksgiving and don't meet with your families and stay clustered up together and that type of thing. But if you are going to be together, whether it's a small group or a big group, here are the things that you can continue, like what we've preached today, to help make this a safe event. And this would just kind of tie into what the schools are going to be doing on their school break, so that when they return from those for the spring semester, that hopefully everyone's healthy. So we can get that out again and share that so that it can be sent out to all the groups.
And to that point, that was going to be one of the things I was going to close with is don't do the potluck lunch at work. You know what I mean? That's the kind of stuff that we're starting to slip on. And while nothing may happen this time, it's going to happen at some point. And we just can't forget where we were at, and how we got to where we are is by doing the right things. And even though we see positivity going up, those at risk are being protected pretty darn well in our community by the things that we're talking about right now. So if you are going to have your older relatives, maybe you have to think about how you're going to handle your Thanksgiving, and with masking and hand washing and all of those things. So is there anything else from the press or the group here that they would want to add before we sign off? I just want to mention for the public, go to the health department's website, look at their best practices. That was one of the things the Healthy Business Alliance worked hard on, to make sure that we added things in there for businesses to protect themselves and their patrons, and then also for the public. It is our central repository for all things that are COVID related in the community. We want to drive people there. So what's that website, John? You're on mute, bud.
Thank you. www.kankakeehealth.org. and it'll come up on the front page, and then you just follow the links, and there's a wealth of information that's on there, daily statistics to just anything and everything about every business that the state has put out, and we continue to update that pretty much daily.
Excellent. Well, with that, we'll sign off. If anybody has any questions, they can also email the health department. I'm sure the hospitals get a lot of questions at any time. So we want to thank everybody for being here, and please have a happy, safe holiday season, and we'll be back with more information as it presents.